Hey everybody, this is State Superintendent Public Instruction Chris Reykdal, and thank you for tuning back into our video series. Last week we talked a lot about school reopening guidance, both for summer and fall, and wanted to make the commitment then and following through now about the questions you have. We've received a lot of questions, as you can imagine. There's a lot that goes into this. We've not been through this for 100 years in the state of Washington and in our country, and so the mechanics of getting school open in a way that is safe and healthy are complicated, to say the least. So let's just get right into the questions, because there's 4 of them that are just absolutely huge, that are driving a lot of the conversation around the state, and then dozens and dozens of smaller questions that districts need to know, and parents and families, but today we'll focus on really 4 of them. Let's start with the big one right now. First question we keep getting from folks is, when you say school's opening or has the potential to open this fall, do you mean every single student is coming back? And the simple answer is very unlikely, almost impossible. Districts are under very strict guidance from the Department of Health around social distancing and other factors that they have to consider when bringing students and our staff back. Safety for our students and our staff is the #1 priority. This is a public health crisis first and foremost. I've been very grateful to work with the Department of Health, our local leaders in our school level, Department of Labor and Industries, who regulates a lot of the safety and health for our workers, and the governor's office. And together, we're trying to create a framework that creates the possibilities for our buildings to be available for some students to come back in face-to-face instruction. It's going to be a great opportunity in a lot of places, but it just simply can't happen everywhere for all students. Our districts need grace. They're working through it right now. They've got physical distancing to think about. They've got to rearrange classrooms. They've got to figure out common spaces. They've got to make sure that there's separation, and we'll talk a little bit more about that. But the simple answer is you can expect virtually all districts to have some opportunity, if the health still is in our favor at the time. But in almost every district, there'll be some version of remote learning or some kind of blended learning, just to simply accommodate all the needs of families and not necessarily have access to the traditional systems, just given the exact health limitations that our districts are under. So the second question we're getting a lot of is, hey, what's the deal with these face masks? And why do we have to wear them? Why do our students have to wear them? Well, this is, again, a Department of Health regulation. OSPI doesn't do anything in terms of this space, but we've tried to combine all the expectations from all the regulatory agencies and us so that it's in one place. That's why it's in our guidance. Health has been a great partner. They have a mission of public health first and foremost in keeping people safe. They are very confident in the research around the world and past pandemics and outbreaks of other things. Masks matter a lot. There's a lot of people who keep thinking about masks in the traditional industrial sense. You need, a face covering to protect yourself from chemicals or other exposures. This is a little bit different. This is about trying to reduce the droplets that come out of our mouths as we speak or sing, particularly if we cough or sneeze. And so the recommendation, and it's so strong that it's more than a recommendation, the standard practice is a mandate that we have cloth face coverings for our students. In some circumstances, a face shield will be available for students as well, and there's some detail in our guidance about that. So why is this such a big deal? To prevent the spread of the disease, which has a scientific basis for these droplets going approximately 6 feet during sneezes and coughs, we want to contain that. And the cloth face mask is all about having the ability to have lots of them in families so that you can wash them regularly. So it is a safe practice to have these masks, and it's essential for us to contain any spread of disease. It is the ultimate shared sacrifice. You're really not wearing it to protect yourself. That's what hand washing is about. That's what avoiding face touching is about. When we wear masks, it's to avoid any spread of our droplets in the event that we are afflicted with COVID, and certainly if we're symptomatic, but even if we're asymptomatic, that is, we're not expressing it, but we actually have it. So it's a requirement. We have to do it. There are exceptions in the guidance because there are some people who just can't medically wear a mask. There are some students who cannot remove it in case of an emergency. So our guidance addresses some of that. But the default here is we have to wear a mask, and it is a mandate from the Department of Health. I know they will continue to look at the research about this, and they will continue to give us guidance about this. But right now, we are planning for that. Families can provide it, but school districts will also have them available for students if they show up without them. Our staff will be required to wear face coverings, and that will be provided by the employer as part of Washington state law for any mandatory safety equipment in the workplace. I know it's tough. I know a lot of you don't think this is right, and I know we live in a country where we really kind of value the liberty of our expression in many ways and how we dress, but there are a lot of safety precautions in our schools. We require a closed-toed shoes, for example, in PE, and we require goggles and other face shields in all of our science environments. So there's a lot of tradition around safety and health around this. This is just a once-in-a-100-year, we hope, only once-in-a-100-year pandemic that's taken the lives of nearly 120,000 Americans and 1,200 Washingtonians. So the safety and health comes first. That's the mask requirement. So the other question we get is about the 6-foot rule. Is it really 6 feet or is it a strong recommendation? It is very clearly 6 feet in what we call the planning framework. So districts right now are working really hard. They're looking at all their classrooms, all of their spaces, and they are planning so that when the bell rings and students sit down for learning, there's a 6-foot distance between all those students and the teacher. It's the planning framework that makes it so hard. It's the reason why many districts can't bring every kid to school every day at the same time, because there are real meaningful guidelines from the Department of Health that restrict the normal class sizes we would generally have. Now people say, but kids are going to get up and move. That's right. The Department of Health has said it's really a duration question. So they want the planning framework to be 6 feet. Kids are going to get up and sharpen a pencil. A teacher's going to move around the classroom and work with individuals. The bell's going to ring and they're going to walk through halls. What makes this tolerable in the world of public health is that we have other metrics that we're using, other measures and other things. We're wearing our face coverings, we're washing our hands, we're frequently cleaning, we have good ventilation in our schools. And it's a short duration, these contacts that are within 6 feet. And so as you can see, our Department of Health is working really, really hard to create this opportunity to bring some of our students back and to have learning available as much as possible in our buildings. That flexibility comes with everyone doing their part, and the 6 feet of distance is so important. Again, average distance of a sneeze or a cough creates the highest probability of mitigating the spread of virus, and it allows, in case we do have cases, for what they call contact tracing. If we've maintained 6 feet of distance, as somebody comes up with a COVID case, it's much easier then to talk to them about when they've had contact with other people within 6 feet for more than 15 minutes. It allows the health experts to quickly figure out who may have been exposed. That way we can have shorter school closures next year if it occurs, get our buildings back open faster. The 6 feet rule is really, really important for everybody. So the other question that comes with the 6 foot is, well, what about buses? I'm hearing that students can be on buses. Again, Department of Health is working hard in their regulatory environment to give us the best opportunity at success in opening school for as many students as we can. That means we got to get kids to and from school, and busing is the way we do that for lots of students. Now we're encouraging families as much as you can this year, drop your kids off, pick them up, walk, ride a bike. Even if you haven't been too comfortable with that in the past, would really have you rethink that. The bus is a shorter duration event. Unlike a classroom where students might be together, particularly in elementary school, for 6 hours at a time, the bus is a relatively short event, and there's a limited amount of time kids will be in contact. But even on buses, we're wearing face coverings. We're washing periodically the bus down and cleaning it. We're cleaning our hands. The windows are open as much as possible. And there are protocols so that the first student who comes on is distant from the second student. It's only at the end of that bus trip where you really have capacity on that bus. It's that kind of flexibility where the Department of Health is being very reasonable. They want safety, and so do we. But they also understand that for schools to be available to as many students as possible in a way that is safe and healthy, they want to make these accommodations for us. It's all in balance, all of these factors. Now, the last question we get a lot of, and it comes from two different angles really, is what if my student isn't coming back? I am a family not comfortable with face coverings and I don't want to send my kid with a face covering, or I'm a family who really wants face covering and I'm concerned that the environment that I'm sending my kid into still isn't healthy or safe enough. So we get this question kind of from both sides. We challenge you to work with your school districts. They know there are concerns by families who really want to stay engaged in the school district, but are uncomfortable perhaps about the return. Districts are working on plans for as many students as they can get in safely and in a way that is healthy, but they also know they want to create accommodation for students in online learning, blended learning models, and all kinds of ways that do the best to engage families in the way that they think will be most successful for them. So work with your school district, figure out what your options are. That is totally locally controlled in terms of the models that they create in their community. But we're sensitive to it, we've heard it, interested Interestingly, it comes from a couple different angles, and we respect that a great deal. I'll conclude with this. The planning framework that's been put in place, there's nothing about this that's perfect. We've never been through this before, but the goal of all of the state agencies in partnership with parents and students and educators was, how can we safely reopen our schools to the extent possible within our space constraints, our physical distancing, our financial limitations? How can we do that? Well, this is the opportunity. We're wearing coverings on our face. We're 6 feet apart. We're planning for that. We're trying to do everything we can for the safety and health and create the opportunity. But it's going to look really different next year, and it's going to be different from one community to another. And again, I just challenge you with grace and patience. Work with your school district, but know that given the health restrictions, it is almost impossible for most of our districts to bring every single kid back. It's going to have to be flexible in our communities. Washington State's amazing. You've heard me say this before. We started as sort of the #1 peak in the country. We're almost 2.5% of the U.S. population. We've gotten our mortalities down to 1% of the total in the country. We've done the right things by trying to be socially distant, physically distanced. We've worn our face coverings. We're washing our hands. We got to double down on that all summer long. Our best chance to open schools and businesses and our faith communities and everything else is that we do our individual part. And I know sometimes that conflicts a little bit with our ideology, but we got to do it. We are one state and we are one country. And right now we got to step up. My parents grew up, interestingly, as teens just after World War II. They were both born in 1935. And so they were teenagers after World War II, and they recall as little kids collecting aluminum, making aluminum balls. Just everything was a sacrifice in terms of resources. And I remember thinking, boy, I'm glad that doesn't happen to us as kids. It's here. This is our World War II moment where we have to make sacrifices. And no one's asking us not to use aluminum foil and turn out the lights at night for safety and all the things that our parents and grandparents went through. But we got to wear face coverings, and we got to wash our hands, and we got to be physically distanced from each other for a while longer. It's the best chance for us to be successful as a state, and I really challenge you to step up and be a part of a community right now that sacrifices a little bit of our own behaviors for the better of all of us. We'll talk to you next time.